I just wanted to take a minute to talk about what's going on in New Jersey with the religious exemption and politics. Some of you know me from college, some from Peace Corps, some from Old Bridge, some from Brazil, some from Surfrider, some from Asbury Park, some from Neptune. And I just want to tell you our story. As some of you know from when I was international traveling and working, I had no issue with vaccines. Never questioned. I just trusted that vaccines were safe and they worked and no problem. Amy and I had our son Michael, and we vaccinated him for the first couple months. Again, because we never questioned it, never thought about it, trusted the system. And when the doctor came in with the polio shot, I just asked him. I said, "What's the need for polio shot when we have no active polio anywhere in North America?" And he really didn't have an answer. He just said it's on the schedule and they need to have the shot, or it's not going to be safe for them. So we continued to ask him, but we never got an answer. So we just took a break from vaccinating just to look a little more detail about what was in the vaccines, what were the concerns. Just look at them closely. During that time, while we were taking that little break, Michael was diagnosed with neurofibromatosis 1. And that was a life-changing event for us. We changed how we lived day to day, how we looked at life. We changed what we put in our bodies, the house we lived in. Everything about our life changed. Our beliefs fundamentally changed. And at that point, we took the religious exemption for vaccinations for our children. And we felt like that was a decision for our family that we felt good about, and didn't think it really had an impact on anyone else. And then about 2 years ago, this hysteria started about the unvaccinated spreading diseases, and the unvaccinated being a threat to the public health. So that was something that was not something we were feeling comfortable with. I wanted to know the answers, if that is actually the case. Are my kids spreading diseases to other kids? Obviously, it had never happened, but could it possibly happen? I wanted to know the answer to that. So I'm a science teacher. I have a science background. My degree is in science, and I wanted to look at reputable sources. And I didn't go to peer-reviewed literature first. I just said, let's go to the CDC and let's actually just look at what they say. And there's a lot there. They say a lot. So the first one I went to was tetanus, because tetanus is like very clear cut. It says CDC says tetanus cannot be spread person to person. So done, easy. Michael can't give tetanus to anybody else. Not a concern. And then we looked at, I think, pertussis next, whooping cough, right? Because we had said prior to our change in belief, we had said, my parents should get whooping cough, and we got whooping cough. We all did it to protect Michael, the vaccine, right? Get vaccinated, not get whooping cough.
Yeah.
So we did that. But then when I read about what the CDC actually says about whooping cough, it says very, very clearly that whooping cough, the pertussis vaccine cannot provide herd immunity. And part of the reason it can't provide herd immunity is because the vaccinated are asymptomatic carriers of the pertussis. So what happens is you're vaccinated and you can go around with the infection without the symptoms, and you can spread it. So in that case, it's actually safer to be unvaccinated, because you would get the whooping cough and I would keep Michael home and he wouldn't spread it at school, as opposed to his classmates who are vaccinated, carrying it around, spreading it without even knowing it. And then the CDC says the same for diphtheria, that the vaccinated can be asymptomatic carriers and obviously spread it as well. So that's D, acellular pertussis, and T, right? So DTaP is not even a question. And then it can't be, the vaccinated in that case are more of a risk to the public than the unvaccinated. So then someone asked me to get in a group about vaccine safety, and hepatitis B was a big discussion. And we were not really worried about hepatitis B. The kids are with us. They're not having sex at age 5. And in that discussion, there was a lot of talk about like kids that are in schools have hepatitis B, like the actual infection, right? You're allowed, the CDC and the government lets you be in a school with hepatitis B, active hepatitis B, chronic hepatitis B. That's what kids get, right? So if it becomes a problem. So that made me feel pretty comfortable because my kids don't have hepatitis B. And even though they're unvaccinated, they're surely less of a risk to the public than a kid who has hepatitis B. So that's DTaP, hepatitis B. That's like almost half of your childhood vaccination schedule in New Jersey. So then there's like the flu shot. And, the flu shot is notorious, but I wanted to check out the information myself. So I looked at the CDC's website, and last 15 years, 39.9% effectiveness rate. So that means about 60% of the people who get the flu shot get the flu. So that is not, that again is such a low rate when you consider the 2.6% of the people in New Jersey who take the religious exemption and are unvaccinated. Do the math, 40% of them are going to be protected. You're talking like less than or around a percent boost in effectiveness for the flu shot in a given year, which again is not any kind of threat any more threat to the public than the vaccinated are. And mumps is the same thing. The CDC says very clearly that mumps is spread during outbreaks, especially by the vaccinated. All those college kids, they all were vaccinated. They got mumps. They spread it. It's just, that's, the CDC says it very clearly. It's not even a question. So that then is, you're feeling like, okay, so you're looking at these things, and this is most of the schedule. There's a couple more. There's HIB, and again, non-typable. HI is the number one most common in all age groups in the United States, and the vaccine doesn't touch any of those non-typable forms. So it's just HIB that it addresses, and that's like a very small percentage of the infections that happen in the United States. So HIB, again, the vaccinated are as susceptible to the untypable as everyone else. So again, they're not. That's not a concern. And then, like, for example, chickenpox, right? All the first graders get their chickenpox vaccine. Then the issue is that chickenpox, the vaccine label says it sheds for 6 weeks, and you should not be around immunocompromised, pregnant women, or infants. And that's just not the case. I work in elementary school. Those first graders are around their teachers. Their teachers are pregnant sometimes. Their little brothers and sisters at home, they're around them. So in that case, again, the vaccinated are more of a threat to the public health than the unvaccinated. And then there's the measles, right? So here comes the measles. Like, this has been like the topic, and the big push is about the measles. And are my kids more of a risk because they're taking the religious exemption than other kids? So I went back and I looked in the peer-reviewed literature. I looked at the CDC website. I looked in old articles. Was there ever a case of someone with the religious exemption starting an outbreak in a school? And I couldn't find a case. I couldn't find any documentation of the case. But there's still this idea with measles that as people take exemptions, the vaccination rate coverage goes down, and the health outcomes, the negative health outcomes for measles, go up. So I said, okay, the way to see if that's true is go back maybe 20 years, like to the mid-90s and 2000s, where we have vaccination rates on the CDC website, coverage rates, and they're about 90 to 92.5, never higher than 92.5 during those 15 years. And you have about the same outcomes. You have like 1 death a year, maybe a couple years no deaths, maybe a death another year, and that's what we have now over the last 10 or 20 years. We have like 1 or 2 deaths every couple of years. So the point is, when vaccination rates were like 5% lower, the health outcomes for measles were the same. So it's not correct when people say, oh, as these rates are going lower, we're getting more measles outcomes that are negative as far as health. It's not true. That's not happening. And the CDC has that very clearly documented with their rates and their death rates for measles. So we felt comfortable that our children are not spreading diseases, and they are not more dangerous than the vaccinated. In a lot of cases, the vaccinated tend to be more of a threat to the public than the unvaccinated. And when you think of unvaccinated people, it's Michael, it's Virginia, it's Audrey, and they're healthy kids. So those concerns are what is people's beliefs, but they're not science as stated by the CDC. So we're here. And we're still here, though, with the religious exemption about to be taken away from families in New Jersey, and we're scared because we love New Jersey, we love Asbury Park, we love the Deal School, we love the Asbury Park school system, and we don't know what to do. There's going to be a vote, and the senators are going to be taking a vote to remove the individual's right to a mandatory medical procedure that carries risks. And when that happens, we're going to have to move. We're going to have to move. We're going to have to leave our community. And it's scary to us. And what I'm asking is that anyone who knows us, that knows us as a family, that respects us and respects our choices and respects our opinion, to please reach out to your senators, reach out to your assembly people in New Jersey, and ask them to protect and preserve New Jersey's religious exemption. Yeah, thank you.